Daellenbach and I live in Aotearoa, and I want to mihi to Ngāi Tahu the iwi there. And I'm a lecturer at our Institute of Canterbury, which is formerly known as CPIT or Christchurch Polytechnic. And now currently a subsidiary of Te Pukenga, obviously. And I'm really pleased to be here and talk to you about an initiative that we have started to integrate sustainability into the Department of Health Practice, where I teach. Okay, thank you. Okay, so the Department of Health Practice at ARA is called also Te Hohe Ora Ki Manawa, and Manawa refers to the building where we are situated, which is not just a building, but it's an innovative way of delivering health education because we are co-located in that space with the CDHB, not Community and Public Health, unfortunately, but many of the DHB managers and educators, as well as University of Canterbury, and we share office and teaching spaces, an open plan office. And what I want to talk to you about today is that just before COVID, really, there was a few of us that were working in different areas, teaching at ARA, that were really interested in sustainability. And we got together and formed a kind of informal sustainability action group. And I think we achieved that, 3.5% tipping point, where which Chenoweth and Stevens talk about as being the amount that you need within an organization to start making significant social change. And we were fortunate too that just after COVID, we were joined by a manager who was very supportive of introducing more sustainability into education and into the way the whole department functions, practices. And what I want to talk to you about today is just two parts of that. It's a very new project, but one is a shared values project that we've started, and the other one is about how we integrate it actually into education of health professionals. So in our department, there are over 1,500 students, and they are enrolled in various nursing programs, including a large Bachelor of Nursing program, medical imaging, a Bachelor of Midwifery, which is where I primarily teach, and a master's program in health practice, health science. And one of the first parts of this project that we started was to create a position of an academic sustainability coordinator, and I was very fortunate to get that role. Okay, so after the COVID lockdown, we decided, the group of us interested in sustainability, that a good way to introduce it more widely to this department with over 100 staff would be to start with a values-based approach. And I thought it was great. David Geller and actually David Pension talked about values-based approach as being integral, as being a way of drawing people together with a shared purpose and a shared vision. And especially kind of thinking about values that were values towards sustainability rather than maybe more neoliberal values that have seeped into education around, in academic freedom and personal success, etc. So these are the values that we came up with. And I think maybe in the department, there may have been some who are a bit cynical about a values based approach like this, but it was really remarkable that over a series of about 3 meetings, how quickly a consensus on these values emerged. And they're all values about relationships. And there are values about relationships not between just us as staff, but also staff, students, and actually also with, us as humans and the planet as well. So one of the things with the sustainability in the department, which I think is probably a key to why it may be quite successful, is there is a really strong bottom-up approach, as well as having a supportive head of department, which I think is key. And the bottom, what we found in the meetings of the Sustainability Action Group and in the other departmental meetings that we had around values, is there were lots of people with lots of inspiration and motivation to work on different kinds of projects. And so what my role is, I think, is very much a coordinator of all of that individual, of all those individual projects and all of that kind of grassroots, ground up innovation. So some of the projects there's within the clinical practice unit, SimFloor, working with the DHB is a really hard look at the resources that are used for, health practice students learning all of that, and how, that can be rationalized, reused, recycled, and where it has to be disposed of, how that can be done. Another simple one is working towards online exams. You can imagine 1,500 students. Many do several exams over the course of their program, the amount of paper that generates. Another initiative is doing community work days, which we can do in paid time. And the person who's organizing this has organized a really appropriate organization, which is Trees for Canterbury. So it's a win-win in looking after the planet, as well as enabling people to feel like they're doing something positive. So this slide is the kind of aspirational one. I think it's aspirational in terms of where we're wanting to go, where we need to go to next. And aspirational too, because I probably can't cover hardly any of this. I just want to point out that I think where we really need to move is recognizing the need to take action in the face of climate and environmental crisis. And also the move to integrating Te Tiriti Oaitangi into education curricula. And that's a wider project that we're embarking on with Te Marina Lenehan, the Kaiarahi of Ara. Okay, so I just want to quickly go over how we can integrate sustainability into the education of health practitioners by using the midwifery example. We've integrated sustainability into the midwifery program for about the last 10 years. But 3 years ago, we created 2 large courses that are purely on sustainability, and both of them have practice elements as well. So this one in first year, which I coordinate, has 50 hours of practice in a primary unit, which is, as we talked about yesterday, primary healthcare is a really important aspect of trying to support health and keeping people out of hospitals. We also have adopted a values-based approach there, and these are the topics that are covered in that program there. I just want to point out that Te Ao Māori values and Te Ao Māori models of health and well-being are covered in a Hauora Māori course, so they're touched on again here, but yeah. Okay, and the assessments that we have for this, I think, are really cool assessments. They really enable students to understand various aspects of sustainability. So the first one is they do a group project, which is a life cycle analysis. The topics in the last couple of years have been around anything to do with infant feeding. So a lot of them look at formula, but they also can look at bottles, breast pumps, all the kinds of things that nappies that are so broadly related to infant feeding. And that's a really great project. Then another assessment is they have to identify at the beginning of the course a self-care strategy to enhance their personal or student sustainability. I mean, and then they have to follow that through and put a reflection on about it at the end. And then the other one is that they have to look in their practice placements and find an example of a sustainable practice in midwifery. And so here I've given an example of a photo from a local birthing unit of a birthing pool, which of course enhances women's opportunity to birth physiologically and not use Entonox. And so they have to find something like that and then do research around it to just demonstrate how that increases sustainability. And in the third year, these are the learning outcomes for the third year course. There's a capstone project which they work together collectively and design a midwifery group practice that is sustainable, using all three tenets of environmental, social, and economic sustainability. And I think the thing I want to emphasize is that the importance of having a bottom-up and a top-down approach, as well as having a really clear idea about what sustainability means and what impact it